Hi, I'm Joy, and this is Yoga with Joy. Today I'm going to take you through a very, very gentle sequence. It's for anyone who has had abdominal surgery. This could be something quite major like a hysterectomy, or it could be a hernia, cesarian section, maybe appendicitis, anything like that. So I'm hoping that if you're following this video that you have had advice from your doctor or physician to that it's okay for you to start doing some gentle exercise. I'm presuming that you will have been taking a lot of bed rest, and that your body maybe is feeling a bit stiff and like it's in need of some kind of attention. So we're going to be doing exercises that are helping your body just to stretch really gently, but we're not going to be doing anything full on. We won't be doing any standing postures or anything like that. So it's really quite a gentle sequence for anyone who has just quite recently had surgery. Okay, make sure that you've had advice that this is okay to do it, and please stop at any time if there's any pain, or if any exercise just doesn't feel good for you at all. So just be really mindful, really careful. If you enjoy my videos, it'd be wonderful if you subscribe, and you can leave any comments. And if you like this video, you can click like. It really helps to carry on for me to make free online yoga videos.
Oh, radiant sun, pure consciousness, flaming orb of truth and bliss, remove the veil so I can see, illuminate my heart, awaken me.
We're going to begin in a comfortable seated position. So this could be Sukhasana. So if you're in bed, or you might be able to sit up with cushions behind you, with pillows behind you. But if you are on a mat, that's great too. And I recommend tilting, just really looking after yourself, being really careful, really mindful of your belly, and finding cushions or pillows to pad you out so that you're sitting really comfortably. I'll actually bring a cushion involved too in my seated position. And again, you can be kneeling if Sukhasana is too much for you. But we'll start with this simple, easy pose. Okay, so just begin to drop into being here, taking a bit of time to give some love and attention to your body. Maybe gently just place your hands on the area that's recently had some surgery. And gently using your hands to acknowledge what your abdomen, this area of your body, has been through. It's quite an amazing thing to have been through this surgery. So taking time to use your hands as a healing tool, and using the prana in your body, the energy in your body, to move through, rising up from your base, right through your belly to heart. And from your heart, you can bring out the energy through your hands, your arms, and then your hands. And bring the energy into your hands to give some love and healing to your abdominal area. And if it doesn't feel okay to be sitting up like this, you can make adjustments so that you're really supported. Maybe you're lying back a little bit if you're in bed or anything. So making yourself comfortable. And gently shifting the head so it's resting over the heart and the heart over the pelvis. Dropping your shoulders, relaxing the face muscles. And with the breath, only breathing as deeply as feels okay. You're noticing the rising on the inhale of your belly. Gentle softening on the exhale. And then gently releasing your hands down. If your back is still okay with sitting in this position, you can stay in this position. Otherwise, shift, make a change. And gently releasing out the neck. So looking over your left shoulder, exhaling. Inhaling forward. Exhaling over to the right. Inhale forward. Remembering gentle softening of the shoulders. Exhale left. Inhale. Exhale. Inhale. Exhale left. Inhale. Exhale right. Inhale. Bring it forward. Okay, we're going to really softly move the left ear to the left shoulder, and the shoulder's going to drop away. Softly over. Inhale up, and then exhale over to the right. So we're stretching out this upper trapezius area here. Inhale up, exhale over. Super gentle. There's no need to rush. The main thing that we're doing at the moment is not rushing. We're just giving our body some love and attention. Lots of healing, lots of gentle relaxing of the nervous system to help with the healing. And so when you finish, you bring the head back up to center. We will bring out the right arm. We're going to bring the right arm over and hook it into the inner crease of your left elbow, stretching out this arm here. And again, if it's feeling too much, don't forget you can move in any way. You can come to kneeling, you can lie back, padding yourself out on cushions, anything like that. If it's feeling just like it's too much to sit up, we won't be being seated for very long in this practice. And then the other way, the left arm in the right elbow crease. Softening the shoulders, remembering to keep this shoulder down and away from the ear. Deep breaths, but not breathing so deeply that it's hurting your abdomen. And then gently releasing arms, rolling the shoulders back. And rolling the shoulders forward. And then releasing down. Fantastic, okay, great. So being super careful, you're bringing your hands onto the mat and gently bring yourself up. If you're finding that it's still hard to, if you've had a big surgery, like it's been a lot and it's involved a lot of your tummy muscles, then just being really careful if it feels too much to even come forward like this, and like you might need to gently tie something around your belly just to support your belly. And we're just coming to cat for a moment, but being really mindful if there's too much, then just opting out and coming maybe back into child's pose with the legs open. So we're exhaling down, looking at the knees, lifting up your back towards the ceiling. Inhale, being super careful because this is a stretch. This is actually a slight stretch of your abdomen. So what you're doing is really, really gently, even waking up the area that's had the surgery, but super gentle. I'm going if you notice, I'm going a lot less, so there's a lot less movement than if I was doing the full expression of this posture. Majjarasana, the cat, this is. So really, it's only doing about 50%, but see how it is. It will be different for every individual. And if your pelvic floor is feeling like it needs some attention, like you've been resting a lot and you've got weak in that area, you can use this time just to gently lift your pelvic floor, your mula bandha. And then bringing the spine back to stillness. And then gently padding out the hands to the left, seeing how that is, side stretch, how's that feeling? Padding the hands back to the center. And then padding the hands over to the right. See how that feels. Is that all right? Just check it out. Is that okay with you? And then bringing the hands back to center. And if that was nice for you, you might want to do that again. Otherwise, bringing your knees out towards the edges of the mat and gently bring yourself back. So you're making a space for your belly area. And bringing yourself down. How's that feeling? And gently rest. Now that might be really okay for you, or you might wish to bring some cushions or some pillows and just lay them on top of each other like that. I don't know about that. I've got some really random cushions here actually. And you could just lay here with the cushions down near your belly and have a little lie down, so they're nothing digging into your belly. And hopefully you're wearing something that is really loose around your middle. And just having a rest. Just rest here. With your head gently resting on the pillows or the cushions. And you can rest for as long as you like. Otherwise, you can come up again. Bringing yourself back up. And then start to bring yourself down onto the mat. So we're going to come down onto our backs, being super careful. So you might actually need to move over onto the side. So coming down so that you're not coming back how I was just about to go there. You move onto the side, placing your hands down and bringing yourself really gently down. And then over onto your back. And you're probably an expert at this by now. Being really mindful of the way you move. So coming here like into semi-supine, as we are. With that, semi-supine means you've got your knees up at the ceiling. And your feet are hip width apart and your knees are hip width apart. And then taking a breath in, inhale. Exhale, super gently lifting up the coccyx and the sacrum. We're doing pelvic tilts. Take a breath in, inhale. Exhale, releasing down. And each time you can lift up your pelvic floor. We're being very, very careful of the belly area. You could even have your hand on the belly just to see how it feels. Keep giving your abdomen some love. Exhale, lifting up. Breath in. Exhale down. If it's too much to breathe in to your lower area, this belly area, you can breathe into your chest and your rib cage. So we can like reduce the expansion of your belly. Take a breath in. Exhale. Breath in. Exhale back down. Can you see that I'm just really subtly tilting my pelvis up? That's all I'm doing. So it's just the coccyx and the sacrum. And we're moving on the exhale. So there's a breath in to repair, and then there's a movement on the exhale. It's making it really, we're targeting the area very subtly and very slowly. So it's just giving yourself a little bit of movement in your pelvis, because it's likely you would have been holding yourself to protect. So there would have been a lot of holding and compensation. So we're just giving some attention to those areas that will have been taking a lot of the weight right now over the last few weeks. And then gently bring the pelvis back to stillness so that you're in neutral spine. I'm going to bring the knees into the chest. So when I say into the chest, you're not actually bringing them right in, because we're being super careful of this area. So just bringing the knees up and just holding them as far back as it feels okay. Far back as you need to, so it feels all right. And then gently rocking the knees so they're coming in towards each other and then away from each other. Away and then towards each other. So really gentle. Circles will probably be super subtle. Quite small circles. And again, of course, if this feels too much, because this is engaging your abdominal muscles, so if it feels too much, just bring your feet down again. Don't do anything that feels too much. If you are doing this, move the knees in the opposite direction. Tiny circles, they're really not very big at all. And if your pelvic floor is feeling okay to do this, you can gently lift up the pelvic floor, and that will protect your abdominal muscles a little bit. Lots of nice deep breaths. Remembering this practice is about relaxing as well. Calming down the nervous system to aid healing. And then gently placing down your legs, your feet. Placing the hands at your side. And we're not going into a twist as such, but just rocking the knees one way and then the other way very gently. One way, then the other way. Exhaling over. Not so that your sacrum here lifts up, your hip bones. Sacrum lift up. Just keeping them on the mat. Gently rocking from side to side. And we're keeping if you have a bit of a sway back like me, you're gently pressing it into the mat. Really lovely breaths. They might not be as deep as you're used to. They might be quite shallow. And then bringing your knees back to center. So we're going to place, we'll lift up the right leg and place the right ankle over the left knee. So this is a wonderful glute stretch. So in this case, it'll be your right glute, your buttock area will be stretched, but we're going to be so careful. And if you have a strap, you can use a strap to hold around if it's too much. And if you have a pillow or cushion, you can place it under your head. We're just going to bring our hands behind and see how that is. Just really feel into how that is. If that's too much, then you can stop at any point if it feels too much. So the stretch is in your right hip area. And flexing this foot, the right foot. Being really careful. So you're taking hold, sorry, I forgot to say, you're taking hold of the back of your thigh. Being really careful. I'm just going to show you with a strap how that would be. So if you need to use a strap because you don't want to be so close to your belly, you can place the strap around the back of your thigh and gently lift. You see how it's a little bit different? You can actually it means you can stay away from your belly a bit. So that's one way of doing it. And then releasing down. I'm going to come to the other side. So the left ankle is over the right knee. And so I'll show you with the strap a bit longer this time. So you're bringing the strap around the back of your thigh, and if you can, it will be your hands. Flex the left foot. And gently bringing the legs in towards you, only as much as is comfortable. Lovely breaths, calming breaths. And remember that one day soon you'll be up doing warriors and all sorts of things. But this is the foundation, building up your subtlety and strength. Again, flexibility and strength is the foundation and will help you for later. So there's not going to be any setbacks. Okay, so actually a strap or a scarf is a really good one for the next exercise as well. So if you have one, that's fantastic. But if you don't, that's fine too. So we're actually keeping this leg, the left leg bent, and we're going to bring up the right leg. So I'm going to show you with a strap, but otherwise if you don't have a strap, you can hold your hand behind your leg, so that your right leg, so that you're stretching out your hamstrings. So if you have a strap, carefully place the strap over the instep of your foot. So the arches of your foot. And just bring in your leg very carefully. Nice. Whew. Deep, long. breaths. So I'm breathing into where is comfortable. Check out if it's okay to breathe into your belly. It might feel all right. Might feel like that's strengthening and it's supportive. But if it doesn't feel good, yeah, stop. So you can see my right foot is flexed. This is creating a stronger stretch down here. And then gently releasing that leg down and bringing up the other leg. A nice stretch of your left leg. Deep, long breaths, calming breaths. Flexed left foot, feeling the stretch along here. Just enjoy other parts of your body getting some attention. And then placing the strap down. And if it didn't feel okay having this a pillow behind you, you don't have to, or a cushion behind you. That feels good. Okay, so bringing yourself over onto your side, either with or without the pillow. So you're coming over here on your left side. Bring your hands to meet each other so they're closed like a book. Taking a breath in, exhale, breath in, lifting up the top hand, seeing how far it feels okay to go. So some of you, this will be far enough. If it feels all right, you can inhale and you're opening up and it's actually a twist. So you're coming into a very gentle twist and you're bringing your right hand behind. We're not going into the full, it's not like a full twist, but it's quite gentle and subtle. Exhale, closed. So that's the movement. So we inhale, open, exhale, closed. Inhale, open. See how far you can go. Exhale, closed. Inhale, open. Exhale, closed. Inhale, open. Exhale, closed. One more time. Inhale, open. Exhale, closed. That's lovely. Okay, so bringing the hands over to the side, and we're going to go on to the other side. So if you just move over to the other side, I'll bring myself down. So I'm going on this side so I can still see you, or you can still see me. So exactly the same, so your knees are closed. Inhale, open. Exhale, closed. So 5 times in your own time. Inhale, open. Exhale, close. Inhale, open. Exhale, closed. Remember, just going as far as feels comfortable. Inhale, open. Exhale, closed. One more time. Inhale, open. exhale closed. Okay, wonderful. So we're going to bringing the cushions or pillows, whatever you've got, blankets, underneath your knees. Making yourself comfy. This is the nice bit. And somewhere I've even got an eye pillow. So if you've got anything like this, you could use this as well. Making yourself comfortable, being careful of your tummy as you move around. Have a nice blanket on top of you. And just fully relax. So as before, I'm inviting you to completely relax all your muscles. Depending on how much exercise you've done recently, that could actually feel like quite a lot. Just having moved your body a little bit and engaged some muscles in a conscious way. So now allow your body to fully integrate the gentle practice you've just done. And again, you may want to put your hands on your belly area, or you could just keep them by the side. You're allowing your body to fully and completely relax. Your breath can just be your natural breath, chest rising and falling, belly rising and falling. And allow yourself to drift if you need to. If you're feeling sleepy. And you're invited, it's highly recommended, if you want to stay for longer in Shavasana, the relaxation posture. Stay for as long as you need to, as long as you would like to. And if you feel ready, you can move on to your side, if that's enough for you. You can really carefully bring yourself up. Place something behind your sit bones and come back up into a seated position. Then place one hand on your chest, your heart area, one hand on your belly. If you wish to, you can give yourself a bit of love and thanks for taking time to look after your body and do this gentle practice. You're welcome to use it at any time. Or create your own exercises that feel right for your body. Just taking a couple of breaths, relaxing the shoulders, face muscles, lifting gently from the crown. Bringing the hands into Namaste. Gently opening your eyes. Thank you for sharing this practice. Thank you for looking after your body, your wonderful body. Namaste. And only fold as far forward as you can and want to. Thank you. I'd love to hear how that was for you. And I'm up for making more videos for after surgery and for any repair of the abdominal area. Have a lovely day.
Oh, radiance and pure consciousness, flaming orb of truth and bliss, remove the veil so I can see, illuminate my heart, awaken me.